My name is Maureen Chung. I am the medical director for the Southcoast Health Breast Program. And we are an integrated program, so we have surgeons, so I'm a breast surgical oncologist. We also have radiologists who specialize in breast imaging. And we have all the consultants for breast cancer. So we have genetics experts, we have medical oncologists, radiation oncologists, plastic surgeons. We have nurses that are trained in breast care. And then we have nurses that are trained in after breast care, so the survivorship. So we're trying to deliver an entire package for the patient. And our big aim is to be patient focused. So when we say patient-centered, we think back 20 years. If a patient had a problem, they went to one doctor, they went to another doctor, then another doctor. And often there wasn't communication between the different doctors. So the poor patient had to explain, I'm here because. The idea of being patient-focused is that if you say need surgery, I can talk to the plastic surgeon. We'll coordinate with the plastic surgeon, so we do everything at the same time. If you need to get chemotherapy for, say, a breast cancer patient, and we want to do that first, we will talk to the medical oncologist. We review everything at our breast cancer tumor board on Fridays, so everyone knows what's going on for you, the patient. So you have less to worry about than before, where you used to run around and take all your charts everywhere. So one of the things we know, if you look at the data from the American College of Surgeons, is that 85% of cancers are diagnosed and treated in the community. And so that's what we want to do at Southcoast. And so we want to provide expert care here so that we can deliver the same care you would get in Boston or elsewhere as you would here. But you're surrounded by family members, so you're going to do better. You do not have to travel very far, and you feel more at home. So that's the whole idea. And so what we've done is that we have different centers across the region. So we span all the way from eastern Rhode Island all the way to the beginning of Cape Cod. And now we're moving south into the Quinnipiac Island, which is southern Rhode Island. The idea being is that we are bringing the best care to you in your home. Rather than having a cookbook of saying you come in with this, we're going to give you that, we take the patient and we have guidelines, but we want to make sure it's the best care for you, not for someone else. And so we take your disease, we find out what kind of stage it is, what kind of characteristics it has, and then we individualize your care that's just for you and no one else. We follow standards, but we want to make sure if it's an elderly patient that we're doing the right thing for someone who's 85 years old. It may not be the same thing as someone who's 45 years old. So that's the whole idea of being individualized. And we have all these tests that allow us to really pick apart the cancer so that we know that before a lot of patients got chemotherapy who did not need it. And now we know those who need it will get it. Those who don't need it will get something else. That's the whole idea between individualized or personalized care. And then we also know that we come from different backgrounds. So yes, you may be female. Yes, you may be 45, but someone may not speak English. So we want to make sure that we have the care that you need in a language that you understand. So we want to make sure that we can get over those barriers. Breast care is really changing rapidly, and Southcoast has made a great investment in keeping up with that technology. So let's talk about a few examples. So if you think back to when we did mammograms, it was what we called two-field mammograms, then became digital mammograms, that was state of the art. Now we're going to what's called tomograms, or what I call three-dimensional imaging, which is like comparing a chest x-ray to a CT scan of the lungs. The detail you get with tomograms is far superior to what we were doing even 5 or 6 years ago. So we made the investment in that, and now every center has tomography or 3D mammograms, but we also invested in being able to biopsy those lesions that we can only see by 3D imaging. That's where we are now. We're continuing to get better and better. So I think in the near future, we're going to go to the next step where you'll actually have what's called contrast enhanced tomography, which I think will be here in the next couple of years. But as we find smaller and smaller cancers, we also want to make sure we individualize the treatment. So for example, for radiation, we used to give radiation over 6 weeks, then it became 4 weeks. Now we can give radiation to the right patient over a day and a half. That's pretty phenomenal when you think about only a few years ago when we were treating people over 6 to 8 weeks. That's the kind of investment we've made at Southcoast, and we're going to keep pushing the envelope. So the next thing we're pushing is that what's called, it's hard to say, oncoplastic surgery. So basically is we're combining the oncology or the cancer work of surgery with our plastic surgeons to give you great outcomes. Now that can be as from something like doing what we call nipple sparing mastectomies, where we're removing the breast tissue and then reconstructing the breast afterwards, which gives you phenomenal results. But also if we have someone with, say, a large breast and we want to take an area out, we can do a breast reduction at the same time as taking their cancer out, and they also have a great result. So we really work closely with the plastic surgeons to get the best care for our patients. And then after we do all that, we want to make sure that the patient doesn't have some of the sequelae or side effects from our treatments. So one of the things we do is we look at lymph nodes under the arm, and that can result in swelling under the arm. But we have bought these special machines that measure what we call impedance. We can call it lymphedema, which is swelling, and it allows us to pick it up a lot sooner than the naked eye can pick it up, and then we can intervene to prevent those patients from getting that swollen arm after surgery. So that's the whole idea what we want to do. We want to minimize our treatments, but we want to make sure they're accurate and right for the patient and minimize the morbidity of what we're doing to you. So if you look at stressors that we face, one of the hardest things for patients to face, other than going through loss of a spouse or a divorce, is actually a cancer diagnosis. It's right up there. And we know that, and it's common. So we want to make sure that we take as much of that stress away from you as possible. We have what we call nurse navigators, and their sole job is to get you through that journey.
So the work philosophy of this department, I would say, is that it's very emotional. I call patients every day to tell them that they have breast cancer or that everything is fine. In either way, that's an emotional conversation. So everybody handles each patient with care and kindness and respect and compassion. If a patient is really struggling with their diagnosis, we will refer them to the social workers to help them with financial issues, with emotional issues, with family issues, with transportation issues. We have an excellent breast cancer support group that meets 3 times a month, and we encourage patients to participate. They can participate either through Microsoft Teams or in person so that it's convenient. They're at home a lot of times on their couch with their pets, so that helps to provide that emotional support with them, for them having their pets with them, as well as talking to other members, other patients that have had a similar journey or are going through similar experiences.
In March of 2024, I had my annual mammogram, and I was called back for a repeat mammogram and possible ultrasound. The radiologist came in after the ultrasound and let me know immediately that he suspected that I had breast cancer in my left breast, that there were a couple of areas of concern that he wanted to biopsy, and a questionable area on my right. In April, I met with Dr. Chung, and I then had 2 biopsies done at the breast center. 4 days later, after my biopsies, the results were in. I met with Dr. Chung, and she let me know that it was confirmed that I had DCIS and also IDC of the left breast, and that the results on the right breast came back normal. It was fine. Knowing that I was going to have 12 weeks of chemotherapy, and knowing that I wasn't going to have to go very far for it, was definitely reassuring as far as my life balance was going. I knew that I needed to have my infusion for possibly an hour and a half, 2 hours, and knowing that I didn't have to add an hour and a half onto travel both ways if I were to be going to Boston. Being diagnosed at 45 years old, I was surprised at the diagnosis, and also very grateful to be able to have the start of the process with yearly mammograms at one location at Southcoast Health, and then be able to go through all of the testing, surgery, and everything after that came with the diagnosis in that one location where I'm receiving comprehensive care. It was so much easier to be able to be close to home, go to the same building every single time I had an appointment, and speak with the people that I knew were communicating and deciding what was best for my care.